Health officials are determined to revolutionize mental health care on St. Lucia, starting with the law. Current mental health legislation dates back to 1895, and the Director of Mental Health Services, Jennifer Joseph, says this outdated guide promotes the segregation of the mentally ill from the rest of society. The reform proposal supports the improvement of mental health services within the community.
But this new piece of legislation will reflect what the ministry wants to do in its policy, and a lot of it is community mental health, where persons will be treated as close as possible to their home and to their places of work.
Chief Medical Officer Dr. Josiah Rambali says mental health has been on the back burner for too long. He says the reform aims to focus attention on one of the most challenging areas of healthcare.
Families didn't understand mental health. The authorities didn't understand it. And unfortunately, even those of us working in the institution did not understand mental health. So we're hoping that we'll bring mental health to a forefront and to protect the families and also the patients who are mentally ill right now.
Dr. Rambali is hopeful that the reform process will erase the stigma attached to mental illness and the treatment of those who suffer from the disease.
When I was working at a mental hospital, when we discharge someone, instead they get support from the community. A lot of people will say, "Nom fu, nom fall," and they will irritate them more. So therefore, the community need to support us and support people who are mentally ill and recognize that they themselves or their family can also become mentally ill.
Feedback from Friday's meeting will be included in the document before it is forwarded to Cabinet for approval. Alison Kentish, HTS News, Channel 4.